Well, Ryan, it's finally good to sit here in studio with you, and welcome aboard TMG.
Thanks. Long time coming.
That's it. It's been a couple of years. So you are you're the second person out of MedTech who's joined TMG. We had Vince Cannon join us a couple months ago. Vince came with an incredible heart failure portfolio resume, if you will. And you've got an incredible background in MedTech as well as the commercial side of things, which you're going to be helping lead within our TMG family. So a little bit about your background for our audience.
Yeah, so I started my career in med device in 2006 with Boston Scientific in their endoscopy division. Did everything there, from a field sales trainer to a global manager of sales training, where I was in charge of Europe, Middle East, and Africa. Then made the move into regional management and ran a team out of West Virginia, Ohio, Indiana. And that was just a great experience. Incredible training. I learned all about the anatomy, disease state, treatment options. After Boston Scientific, I spent some time with cardiovascular systems, so still catheter-based technology, but more on the heart side, peripheral artery disease, coronary artery disease, and most recently with Ambu in the single-use scope space. So a lot with pulmonary endoscopy, a lot with gastroenterology over my 15-plus year career.
And what was exciting for us was as we continue to expand out, I mean, we're in the UK now, Canada now, soon to be Southern Cal, Ohio. We're heading over to Israel in August to do some scouting for new facilities there. But obviously having the experience in MedTech and understanding, to your point, technologies, anatomy, but also the leadership.
Sure.
So you are at director level, finally at a director level at Ambu, and heading up large sales organizations. And bringing that experience to our clients. As you know, you sat in your first 2 weeks here, and we're helping organizations, emerging tech startups, put together their sales teams, put together their sales strategy, put together their comp plans.
Yeah.
So that's an incredible value for us as we continue to add value to our client base. If I'm a new salesperson looking at career choices. So I'm at a university,
Right.
I want to get into MedTech. So
Yeah.
I'll ask you this in two stages. The first one is the beginner, right?
Okay.
I'm out. You see all these MedTech sales rep online classes, all that kind of stuff. And,
Sure.
and I don't want to disrespect those.
No.
Before I even get into that class, what should I be thinking about when I make a decision on the state of MedTech today?
Wow, I could go so many different directions with that. I mean, first of all, I started my career at a company called Cintas, where I got the basics of sales. They don't really teach sales in med device. Some companies do, or they'll try to adopt, the challenger sales model or spin selling, some sort of sales. But really, if you can get that sales background and then make the jump, I think that's extremely helpful. And there's all kinds of companies out there that have great sales programs. The other thing to look at is, what companies are starting to see attrition and which ones are hiring. For example, you have all these companies with remote case support now, right? So if I'm thinking they're eliminating Salesforce, do I want to go to a company that's supporting this type of technology so I can be more efficient as one rep covering multiple cases in multiple states? So you see a lot of these med device companies adopting those various technologies now, and that's something I would look at. Because if you're still stuck on the older model where it's, knocking on doors, trying to do case coverage, that's going away. Access is being limited. I mean, I wish I was the guy that came up with the credentialing services, right? And now you have, rep scrubs where you have to go to a vending machine and get scrubs. Or some hospitals have you put on, the ugliest jumpsuit you could imagine so everybody knows you're the rep, right? So I know I'm going off topic here a bit, but for me, it's really looking at what companies are known for excellent training, because if you don't get that out of the gates, you can become discouraged, right? And we talk about the 4 phases of situational leadership a lot, right? So you hire somebody in med tech and they are enthusiastic beginners. And then they hit a wall, like I did here this week a little bit, and you become a disillusioned learner, right? And then you're like, oh man, maybe I don't know everything I thought I knew. And then sometimes you become a reluctant contributor. And you don't want that. You want to be a peak performer. That's the 4th stage. So how do we take them from enthusiastic beginner to peak performer and keep them there? And so for me, it's picking the right company based on their training model, if you will, and then seeing that they're adopting and adapting and evolving with the market.
And with that, so there's your sales function, and I get that too. Medical device historically has not built their critical mass right out of university. Right? They look for Enterprise Rent-A-Car, Cintas, or some of these others that have world-class, start at the bottom of the office building, get to the top, and earn your stripes in that first year or two, and then let me pick you off, and now let me just put you through anatomy training and tech training. I've been at this since 1989, and I've seen the wave of technologies displace others. But I've seen balloon angioplasty get replaced by stenting, get replaced by drug-eluting stents, getting replaced by next in line. But what I haven't seen is the compromise of the sales process, where things now are being commoditized. You've got the telepresence capability. You've got the Amazoning of certain mid to low tech coming on very quickly. You've got ambulatory surgical centers now coming. And yet the large strategics, for the most part, have not changed their go-to-market model yet. And they're taking sales reps who were trained 10, 15, 20 years ago. And if you're not adding substantial clinical value bedside to the clinician, the interventionalist, the surgeon, are you at risk?
Yeah, I think you are. And that's what you need to look at is, am I in a space where a therapeutic procedure is being done and they need my support? What COVID did was it kind of exposed a lot of people, right? Can we get away with doing this procedure without the support we're used to? And a lot of them answered that with yes, right? Either the techs had to step up, or the nurses stepped up, or the doctors became, they're the constant in every procedure, right? They became the expert and said, maybe I don't need this person in the room every time. It's a security blanket, but it's not a need. It's a nice to have, not a need to have. So really position yourself in those companies where you're offering great value to a therapeutic procedure, and that you can see a runway for that for a long way out. Otherwise, a lot of these diagnostic procedures, as you mentioned, it becomes a commodity thing, and they really don't need a rep when they could just click a mouse and order it online.
And with that, it also brought to the forefront telehealth. So you can still get enough support, whether it's a Proximie system or an Avail system, or even in that case, we're watching people do Zoom, right, or FaceTime on these. Now, the legality of that and patient security, that's a whole nother situation. But to that point, we're seeing that entire process be compromised. So staying on product here, I'm really interested in this. So I was chatting with a VP from a major scope company this past week.
Good timing.
Yes, I was at DDW this past week or the week before. And you and I have been watching the single-use scope, single-use visualization market emerge. And I think he told me there were 15 single-use scope companies that he could count right now that have put their head above the water. What does that mean to that market in particular, as an example, as an analog to the rest of the markets? And I've watched that happen in the balloon market. I watched it happen in the stent market. I watched it happen in robotics. It ends up being 2 or 3 players that pretty much dominate 80% of the market. So what are your thoughts, leaving the specifics of Ambu out of it, others, but what do you think about while you were in that market?
Well, I think about the patient, right? I always bring it back to the patient, and patients can't choose an option they don't know exists. Well, right now it's kind of under the radar. Single-use scopes aren't known. They're not being advertised, if you will. But what starts happening as these Facebook groups start and people start talking is they realize they have an option. And if you tell a patient, hey, you have this scope that's been used on hundreds of thousands of other patients, and we're going to use it on you, or you can use this one that's only going to be used on you, what do you think they're going to choose? It's going to be the single-use scope. It just reduces so many issues. It eliminates the risk of infection, which is huge, especially in the COVID era, right? It reduces the need to reprocess. So this is the big one for me. There's staff shortages everywhere. And it takes a lot to train people and get them up to speed. And what do you have with human beings? You have human error. So you eliminate the human out of the equation. You grab a scope, you plug it in, you use it. When it's done, you throw it in a recycling bin, grab a new one. That's it. So to me, once it reaches critical mass, and it's going to, right? It adds credibility to the space, the more players. So if you saw, they saw 15, at DDW, that doesn't surprise me. Just in my time in my previous companies, you would see people coming from all over the world with new products. So you think here in the US, like, oh, we've got company one, company two, that's cool, we'll duke it out. No, you're gonna have somebody from Asia Pacific coming in at about half the price, just as good a quality, and then what do, right? Do you acquire them? Do you lock your people up with contracts so they can't come in? So there's a lot of different things to look at in that space, but to me, it's really, if you make it about the patient and about the person in the hospital, right? You also have to protect the nurses, the techs, the staff that are cleaning these things, right? And one last point on this, workflow efficiency, right? So physicians, hospitals, they get paid on these elective procedures. The more they do, the more money they make. How much downtime do you have when you're waiting an hour for a scope to be cleaned versus just knocking out case after case after case after case? And the whole acquisition side of things with scopes the way they are now can get pricey too. So you'll see some of the major players, and we've already seen it, partnering with single-use scope companies and sliding it into their portfolios. So I don't know how quickly you'll see it flip. I think it's going to be a slow process, but when it flips, it's gonna go all the way.
It's that old adage: everything happens slowly until it's sudden.
Yeah.
Right?
Yeah, the tipping
and I
point.
think we're going to see that. And you brought up an interesting point here, and I'm going to key in on one word you used: hospital. So the changing centers of care right now, you talk about reprocessing and sterilization. That takes up not only training and sort of the liability with that, but also as we move changing centers of care to ambulatory surgical centers. And these ASCs now are owned by docs. They're owned by private equity companies.
Yeah.
They're owned by people who are force ranking where are we spending our money and what is the real cost of that piece of equipment. So if I'm in an ASC, how many extra 100 square feet, 200 square feet plus liability I have, because it's a pretty caustic environment to sterilize a scope.
Yes.
And every time I have a scope offline, I can't have a procedure.
Correct.
And so I think also that entire logistics supply chain of the ASC model is going to impact, and I'm wondering if these new nimble companies out there are going to adopt to that more quickly than maybe a Fuji or a Storz or an Olympus, who are so used to rank and file, coming in, bundling everything in, coming into a hospital and saying, here you go, we'll give you this. Now we're going to start to have more of an a la carte, I think, in that area. So that'll be interesting to watch. And again, I only pick single-use sort of visualization systems because that's what you're most recently coming at. I'm seeing that battle going on. I'm seeing it going on in the robotic platforms as well.
Yep.
The biggest challenge most surgical robotic companies, whether it's ortho, whether it's soft tissue, is what is the visualization system and how do we harness that into our platform. And I think you're going to see more of an open architecture in that area, because there's no way for you to do that and master both the visualization, the robotics, as well as the cloud-based and the digital side of things. So that's fascinating. So then another subject that came up is, so you made this decision to get into the crazy world of search. Now, I'm going to be a little biased here. TMG is unlike any other search company in the world. We've dominated the space for coming on 3 decades now. We really are a consulting company that do search. We've got a full production company. We've got a full media company. We do more searches by about 3 to 4x than even our nearest competitor. So I would say you're getting into search, but how did you process making that investment? What went through your head, and how did you get to us sitting here today?
Yeah, I looked at the Mullings Group years ago as not a search company, but a subject matter expert on the med device space. So when, as a med device veteran, you start learning more from a search company than you're learning in the boardroom of your own industry, that's when you perk up and listen. And what I've realized is you, Matt, Holly, that's who I've known for the longest, you're subject matter experts across every vertical within this space. And that is, for me as a continuous learner, that's something I like. So, you know, you kind of get in your lane and you stay in that silo when you're in med device, and it becomes almost cultish, if you will, because you have to believe in your company and your product and be passionate. And what I got from the Mullings Group in engaging with all your content and all your subject matter experts is just a broader vision of the industry itself. So for me, this was really like an extension of what I've been doing all these years, but now I get to help people in an entirely different way. Before I was limited to the people that were under my care as a leader. Now I get to go after anybody and say, hey, here's the opportunity. What do you think? Does this work for you and your family? Do you have the support system to make this move? Do you have the courage to make this move, right? Because we all get comfortable and sometimes complacent. And that's what I hope to not coach people through, but just help them through on this thing, that we all go through, which is a career journey.
Yeah. Well, you had to make that decision yourself too. So if you don't mind, I mean, what were those evenings laying with your head on the pillow, staring at the ceiling, going, okay, hold on a second.
Yeah.
I just invested 20 years in this career.
Sure.
What was that like?
Well, first of all, talking to you made it easier, so I appreciate it. You made me feel valuable in my space, and that gave me the courage to make this move, first of all, so thank you for that. But secondary, you have to have a support system at home. And so when I talked to my wife about this, she's always been my biggest cheerleader, and she said, hey, if you're not going to bet on yourself, who are you betting on? So I knew I could do it. I knew I could make the move. The question is, you have to answer why. Why do you want to do this? Are you not happy with what you're doing currently? Are you not challenged? And so I made a list of questions, and I'm pretty good at this. I get a legal pad out, and I just draw a line down the middle, right? And on the left is pros, on the right is cons. And then at the very bottom, I have to answer why stay with what you're doing and why change. And really, the why change was overwhelming. I did a thing called a life plan a couple years ago. A lot of people probably haven't heard of it. It's based on this thing called the Patterson Principle. But what I found out of this 2-day immersive, who am I type of activity was, I really want to help people that are getting into the workforce for the first time, so high school or college kids, and then those people that are in career transitions. And I've been through those myself, so I know how challenging it can be, from building a proper LinkedIn profile to getting a resume done to mock interviews. And so now I get to do all those things in this role. And I couldn't really do that before. Before I was so focused on quota and hitting the number and getting my people promoted that I couldn't do what I love most, which was helping people get to where they want to get in their career, if that makes sense.
And I'm curious, we haven't talked about this. You finished up your second week now.
Yeah.
And
third, actually.
That's right.
Second
third,
in-house.
Right, second in-house. That's right. That's exactly right. And your first day here, I was out with COVID. Your first half year.
You're late to the game, Joe.
I am late. I've always been late. So I always thought I was going to beat COVID, but COVID beat me this time. Well, it didn't beat me. Your first couple days we were together in the office. I mean, you sat in with 3 or 4 profound CEOs, all emerging tech startups. You got to listen. You added value immediately. We're helping one design his sales organization he's a UK company coming over here to the US with a really cool disruptive technology. You sat in on another and were able to comment, we're building a 10-person sales force on a AI-based visualization platform. So what was firing off in your head at that point in time as you were sitting there like call after call? That day, I think we knocked out 3, you and I. How exciting was that?
I just thought to myself, this is where I belong. At most companies I was at, my mentality was, be grateful, but put your head down and just work. And here I can honestly say that this company is at my speed. And that's not to say that other companies, anything against other companies I've been at, but there's a lot of bureaucracy as you build a company, and there's more people and more levels, and you need to be respectful of that. And I was always just a go, 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 go kind of person. And I always tell people I'd rather, reel somebody in than have to whip them, right? So here, like, you're not gonna reel me in, you're not gonna have to whip me, I'm just gonna go. And that's what I love, is as soon as these companies engage with us, we just get to explode. And all these thoughts and ideas, after we listen carefully to what they're looking for, boom, we go. And by the way, these 5-minute updates and these 15-minute meetings, we need to record these, send them out to corporate America. You would make so many sales reps, so many managers happy. It's a good format. I love it.
You said that in the meeting, and it's always been Riggers du jour here, and it's normal SOPs is we don't waste our time with meetings.
Right.
right? We're big communicators, but it doesn't take an entire camp to get something done. That one meeting, I think, in your first week here, you were like, he's like, that's it? Like, that 5-minute meeting? I'm like, and everything was like 17 people in the room, right? To get done what we had to get done, and we were gone.
It's like a dream come true. I always say, less talk, more action. I'm a big Tim Ferriss disciple. He wrote the 4-Hour Work Week, 4-Hour Body, and you probably saw me write it on my dry erase board, but it's something I ask myself every day is am I being productive, or am I just being active? And here we are productive. I mean, a level of productivity I've not seen anywhere in my career. So I think I'm going to like it here.
Awesome. Well, thanks for sharing your thoughts and your early days on this. And I'm excited for you. We've got your own podcast coming up. You're already driving, I think, 2 coming on 3 big client initiatives for us right now. Our clients are super fortunate to have you as part of their team, bringing us on board. And you are also going to be moving from the heartland of America down to groovy Palm Beach. So I'm excited about that as well.
Me too.
Thanks, man.
Thanks, Joe.
I'm Joe Mullings from 160 Studios with Ryan Blasko. Be well.